Good morning, everyone. So, imagine you have done a very good surgery, good margins, and maybe ITF clearance as well. And the next day in your wards, you see your patient has developed marginal necrosis near your midline lip split incision. So it is very disappointing, isn't it? Because your patient does not know what a beautiful surgery is, but he surely does know what is the beauty of his face. So here I am to discuss a novel technique to prevent marginal necrosis associated with midline lip split incisions by preserving the reverse flow in facial artery. Good morning, my name is Dr. Bhagyashree Deshmankar and I am from Bhagwan Mahavir Cancer Hospital and Research Center, Jaipur. My co-author and my guide is Dr. Prashant Sharma. So imagine if this is your patient. What is the incision that you would like to put in this patient? Obviously, as evident by literature and as evident by our post-hoc results, the midline lip split is the best incision in terms of cosmetic and functional outcomes. But all procedures come with some complications, so this is also associated with ipsilateral marginal necrosis in few of your patients. But why does this happen? So to discuss that, let's see a little bit of anatomy. So this part of the face is supplied by facial artery, which gives its branches inferior labial artery, superior labial artery, lateral nasal artery, and angular artery. Now these arteries anastomose with the counterparts from the opposite side and some branches from the internal maxillary artery. So for any vessel, if you cut it, its proximal end should start bleeding. Same happens for the facial artery. When you cut it, it starts bleeding. Something like this. But for the facial artery, when you cut it, its distal end also starts bleeding, and this phenomena is known as reverse flow in the facial artery. So here we are cutting the distal clipped end of the facial artery and see it has started bleeding. Can change the slide. So while we were doing our dissections, so we noticed an interesting pattern which was present just posterior to modulus. So this part of the facial artery which was constantly present posterior to the modulus, and this part is actually the juncture of facial artery with its branches, and we have called this as Jaipur junction. So this is our intra-op picture. Now if you imagine a horizontal plane passing between two angles of mouth, then the facial blood supply can be divided into an upper arterial territory and a lower arterial territory. And Jaipur junction is in fact the connection between the two. Now let's get back to our question. So what happens when you have already cut your facial artery and you put a midline lip split incision? Then your inferior labial artery is gone. Now this part of your face is dependent on the reverse flow of facial artery and then subcutaneous and intradermal plexuses. Now this is not a very reliable source of blood supply, but the reverse flow, is a very reliable supply of blood, because as some studies show, it has 76% retrograde flow has 76% pressure as that of systemic arterial pressure. So this is a very reliable source of blood supply. But what happens when in such patient, when you have already cut the facial artery and you are putting midline lip split? See, this is a nice reverse flow in the facial artery. But if you also clip the Jaipur junction, let's see what happens. So here, after clipping Jaipur junction, as you can see, the reverse flow is gone. We'll unclip it again, and as you can see, there's again a nice blood flow. So the moral of the story is that whenever you are doing a midline lip split incision and your facial artery is compromised, then you have to preserve the Jaipur junction. And if at all during your surgery, if you think that this part of your face is going to be affected, the angle of mouth, if that is going to be affected, maybe because of an advanced disease, then you should entirely avoid the midline lip split incisions and you should try for some other incision. So take home messages, the Jaipur junction and Deshmarker's plane are landmark in head and neck surgery, and they should be taken into consideration whenever you are doing an incision planning. Thank you.
So, nice presentation.
Thank you, sir.
So, this Jaipur junction and the reverse flow, for those of us that don't do head and neck surgery, is that something, a new concept?
Yes, sir. So reverse flow is it has been studied since a long time. There are in fact some flaps like buccinator myomycosal flap which are planned on reverse flow. But this part, the Jaipur junction, this part of the facial artery, this we have seen during our dissections. So we have done up to 300 dissections, and this part was constantly present. And by clipping, when we clip this part, it definitely stops the reverse flow. So this is a new concept. Reverse flow has been known, and reverse flow is known in fact for some other also, like the radial forearm flap. In that is also based on the reverse flow.
Thank you.
Thank you, sir.
Suppose there is no reverse flow, what do you do?
So that is what happens is sometimes if your this flap acts like a random flap. So if your subcutaneous intradermal plexuses are good enough, then this will be preserved. But if not, then this part is definitely going to develop ipsilateral marginal necrosis.
No, but to prevent that ipsilateral marginal necrosis, do you anastomose the vessels back again?
Sorry, sir.
Do you anastomose the facial artery back again?
In such surgeries, basically we are taking facial artery, we are clipping the facial artery mostly in our head neck surgeries to anastomose with our flap, so that we don't have an option. Then all we can do is, once the patient develops a marginal necrosis, we just debride this part and then resuture it. This flap will act like a random pattern flap, so it will have some blood supply but not a definitive one. So whatever supply is patent, we'll just wait for the marginal necrosis to develop, and then we can debride that region and then we can resuture it in post-operative period.
Thank you.
Thank you.
Thank you, Dr. Bhagreshri. Next, we have already completed series.